for the 2020 election, that there are actually, I don't know, I'm sure I don't know if they dropped out.
They're going to drop out soon.
Well, I'm sure they are, but because who would ever try to run against the incumbent Donald Trump, like, on the Republican side? There's absolutely no way that he would actually lose to a Republican that is just going to jump in the race this year, right? Yeah. That's barely ever happened. So, who do you think's going to win the Democratic nomination?
I think Bernie's really pulling through as to what I've seen, but I know Biden is currently really appealing to that kind of like classic leftist, like, don't want things to change, just want like a normal left-leaning president. But I think Bernie is getting the young vote. He's getting more of like the radical votes, and not like far left. But people who want change are looking to Bernie. I think Bernie has a really good chance. I think either Bernie or Biden. I'm not sure about Warren. I feel like Warren at times can sometimes come off as unable to compromise with the other side, and that's good for her own voter base, but not good for trying to get other. If they're
trying to undecided people, that's going to be bad for her. And just his mention of Warren, just to show you this video.
What are you going to show?
No. It's a video of her at a one of her own rallies. Just roll the clip. Not saying that we should vote just because of that clip, but I just want to show you that.
That was funny though. But
okay, so bring up what you mentioned about Joe Biden again real quick.
Yeah, but okay, so at one of his rallies, a person got the mic, and the audio is so bad, it's so funny. It's like
yeah.
But so this person was bringing up Biden's son and
Hunter Biden.
Yeah, Hunter Biden, and Biden didn't want to deal with it, so instead he started attacking the man as like a person, and in the end he was like challenging him to a push-up contest, and people were clapping, and I'm just like
supporting Biden?
Yeah. And so
that's
I'm like,
ridiculous.
Dude, that's not how you get the votes. I mean, maybe in that small group.
But you, on the other hand, send your son over there, get a job and work for a gas company that you had no experience with gas, did nothing. In order to get access to the public, for the president. So you're selling access to the president just like he is. So
you're a damn liar, man. That's not true. And no one has ever said that? No one has heard that?
I see it on the TV.
You see it on the TV. No, I know you do. And by the way, that's why I'm not sedentary. I get up and no, let him go. Let him go. Look, the reason I'm running is because I've been around a long time and I know more than most people know. And I can get things done. That's why I'm running. And you want to check my shape on, let's do push-ups together here, man. Let's run. Let's do whatever you want to do. Let's take an IQ test. Number two, no one has said my son has done anything wrong, and I did not on any occasion. And no one has ever said it.
To check my shape.
What did the guy even say? What did the guy even? Was he criticizing? Was he criticizing Biden?
Yeah, they missed it in this clip. But I find it funny how I think even the Young Turks who are like for Bernie are like against this.
Yeah.
I think this is just silly. This is just like, what are you doing?
Well. Yeah. And I don't know actually what he's like, because he said like
what this guy said
because Biden was saying that he's accusing his shape or whatever.
Yeah.
So maybe he said like because with like like when Hillary Clinton was running, how she was getting sick or whatever, and everybody's like accusing their age and all that kind of stuff, like with Bernie as well, him being up in age too. So maybe he was like, man, you're way too old to be president, maybe something like that. But even then,
to be fair, he was really going in, and the types of questions that he was asking, it wasn't innocent. Like he wasn't like, oh, could you just address this? He was like going and he's like, I think you are like an unstable, like he was really
attacking.
I think Biden would have shown more strength if he did it in a calm way, but he just kind of lashed out. But to be fair, I mean, like, if you saw what this guy said, like, it wasn't nice. It was like he was going in.
Okay, and then now going back to what you were talking about with how you think Bernie can be the Democratic nominee, and by getting conservatives or like right-leaning supporters that don't think Trump did enough, what do you think? Do you believe that Trump hadn't done enough and that we need to go to Biden or to Bernie?
Yeah, I feel like Trump hasn't fully done enough for this country, or hasn't fulfilled the promises that he made to his right-leaning supporters. Not that I agreed with those promises in the first place, but the building of the wall and doing all these things. He I wish I had some stuff in front of me but like I feel as though he hasn't addressed the promises that he made to his fans in the first place. So I think I'm like just thinking about those people. I think they'll look at this and be like, I need some sort of change, specifically to those working class people. And under Bernie really cares about those people and caters to them. So while the economy may be doing well under Trump, I think these working class people are looking to someone to speak for them. And they might see that in Bernie, who has championed workers' rights, he's for health care and all that stuff, and these middle class workers would look to him for it. Not saying that's all of Trump's voter base, it's not, but you know.
Like just speaking from like what you said about like healthcare and stuff, is that an issue that could be honest with? I have a first person like anecdote that I can share.
Experience, okay.
So my dad, he works in the medical industry. He was a biomedical engineer. He works for Abbott Laboratories and previously St. Jude Medical. Then he was like a higher up manager of one of the departments. After Obamacare came in, his position was wiped out, and he had to move down to a lower position. And so essentially, he basically got fired and had to be rehired by the same company at a lower position. So it's essentially hurting private industry. There needs to be a balance between private and public, like in other countries. So like, for example, like we don't necessarily need to have all government-based hospitals. Like we should have a private and a public sector at the same time. It's kind of like my opinion.
Well, I mean, I'm sure. I'm just guessing, but I know that Bernie has a plan for those people with jobs in the private area. When it comes to healthcare, we aren't just going to throw all those people out. I know Bernie has a plan. I think I was listening on NPR. He was talking about how, granted, there would be few private sectors when it came to healthcare for people to get jobs in. There would be then jobs in the public sector. And I think people, in favor of the health of the country as a whole, people could, not saying, it's easy, just find a new job. But I think to try and transition these people into not a new line of work, but a new type of work.
Yes. And like currently under federal law, it's impossible for hospitals to refuse service to anyone, regardless of like whether or not they're able to pay for it. That's why like the debate with like healthcare for illegal immigrants has kind of come up. Because like if you're an illegal immigrant and you don't like have a bank account, you can prove that you don't have any money, and then you can go and get the healthcare for free. And then in turn, other patients pay for it because it gets distributed among future like costs of the hospital. So it's more of like an insurance thing, is saying like hospitals don't go into debt. That's kind of what it's trying to balance.
Well, but then like how do we help those people who can't pay their medical bills and are forced to not get help? Because as you said, unless there's a system that I'm unaware of, like there are people who genuinely just can't get help because they can't afford it. We don't have universal healthcare.
Why don't? So now backing off of not being able to afford healthcare, why don't you think they're able to afford healthcare?
Because of the
or even get a job that gives them healthcare,
like benefits. Yeah.
Then I think that's down to employers to give them those benefits.
But a lot of jobs do, other than like minimum wage paying jobs like McDonald's, right? But why aren't they able to get those I don't know, maybe like office jobs that would most likely give you those healthcare benefits?
Yeah, because like a lot of companies are required to give their employees benefits. One of those including like healthcare benefits. Like under Obamacare, I believe like a lot of like corporations that meet a certain threshold are required to provide their employees with those benefits.
So the thing is, under Obamacare, because it is not perfect, I don't think Obamacare is perfect. I think it was. I think it was moving towards what Bernie was looking for, but Obama knew that they could never reach that. Like you need someone in power and a Congress, or at least a House that agrees with you. But moving on, I think employers play into Obamacare by barely not meeting the requirements to give benefits, and that's a fault of Obamacare because they allow these employers to find the loophole. So, I don't have to give you health care if I only hire you for these hours. But you still need a job. I know that you still need a job, so you can come to me. I just
But
want
only
to give you
for
benefits.
right.
And then
So it's like how can we fix that? Because I think maybe it wouldn't be as much of an issue if there weren't either loopholes like that or people could genuinely afford it.
And then again, like, it also comes into like how constitutional Obamacare is, because like I believe the Supreme Court overruled that one of like the sections of the Affordable Care Act was considered unconstitutional, as it forced citizens who can afford health insurance to buy health insurance. Like, it required them to buy insurance where, like, legally you can't force someone to buy something from a private company. So like, are you saying that this like health insurance for universal health care would be government, like entirely government provider, or would be like a mandate to be?
I mean, we are talking about Bernie's plan, like not something that I'm coming up with, but I mean, like to speak on Bernie's plan, I do believe that he basically framed it as a shift left from private healthcare and more to public healthcare. I would like someone to just fact check this, so I'm not getting his viewpoints wrong. But I do believe under universal healthcare, it is healthcare for all, but I'm not sure if people can pay premium for better healthcare or like a different plan.
So, and then now,
Because I don't believe he's forcing everyone to get healthcare. I think it's just you have healthcare, and that's the whole thing.
okay, so now backing off of that, like kind of piggybacking off of that, how you mentioned how you think Bernie is going to able to fill those holes that Trump wasn't able to meet with healthcare, right? You said healthcare, and what we had mentioned that is if people were able to actually get those jobs that offer healthcare, right? There's the fault that he had mentioned about how they're able to get people but only have them work a certain amount of hours, so they're not eligible for that healthcare. Now, without that loophole, it would fix a lot of things. Now, this is from whitehouse.gov. Trump, when Trump was elected in November of 2016, the U.S. economy has created 5 million jobs. Those 5 million jobs are going to the people that desperately need those jobs. And a lot of those jobs are a lot of factory working jobs, which have what are those? What are those? The like worker
blue collar.
No.
Union?
Yes, union. Right, because factories, a lot of those like more blue collar jobs, have unions.
Do we know that most of those jobs are going to union workers?
Yes. Yeah, because look at like Foxconn, right?
Yes.
Foxconn in Wisconsin. That's a very blue collar job, and they're bringing a lot of factories from China back over to America.
Yes.
And I think a lot of those unions are able to fight for the workers' rights. And if they can only work a minimum amount of hours and not get that health care, I think those unions will be able to fight that. And then, in turn, getting those workers the health care that is needed. So I think this massive job creation is able to give these workers the opportunity to have health care. But the big problem is the motivation to actually go out and get those jobs. That's just a massive problem, right? I understand there's people with drug addictions, homeless people, right? There are so many like sources that you can go to get help with that, and be able to find a job, get your life cleaned up.
Well, not necessarily. I think there's certain outside factors that we cannot control, and that homeless shelters are being filled up to the point that people can't get a home when it's cold out.
Right,
and
look at like Tent City in Milwaukee. They're because of the Democratic National Convention is coming here to Milwaukee. I think they're all
to make it look nice.
Right. They're all shoveling them into a building, right, and then right after they're going to release them back because they don't have enough room to hold all those people
and like support them.
Yeah.
So then we need to fund these public services to help these people get back on their feet, because I think it's not just up to them. I think we need to recognize that you do need someone to help push you, not to not to freeload, but to get you back to where you want to be in life. And
exactly.
that comes from actually funding social services, not do what Trump is doing and putting more money into the army.
Yes. So,
I think we do need to recognize that it's a effort on both the person and the government.
Yeah, so like my compromise, like with that idea of like getting people back on their feet, like with the welfare system, like my opinion is that we should have a welfare system, but the current one is broken, in my opinion.
How so?
Like compare it to the one in Singapore, for example, where they're like project housing and stuff, where there's a lot of poor people, where they had an effective system where they were able to build project housing and sell it virtually sell it to like the homeless people and the low income people for a very low price, and then they owned that virtually, and it grew in price, so then therefore they could sell it, move to another place, and they would have money on their back. Whereas this government system is just kind of giving you like food stamps and like free government welfare paychecks and stuff. So as soon as the government hands over that check to the citizen, they don't know where that money's going.
Mm-hmm.
So if we had like more of a probationary system where we gave like these homeless people or these low-income, poverty-stricken Americans, if we gave them money, the government could track where it's going and how they're spending it to see whether or not they're using the money effectively to get back on their feet, or whether they're just using it to like kind of fund their low-income life.
I do see that because, I mean, I'm not going to act as though there aren't people who use government funding in the wrong way. But at the same time, assuming that everyone's like that kind of goes against the whole point of it in the first place. Because, I mean, like, people who aren't on their feet want to get back on their feet. And I'm not, and again, like I just said this, but I'm not trying to act as though people aren't going to misuse it, but going off the assumption that everyone's going to misuse it kind of defeats the purpose.
Right, and it's definitely the fault of the not like racial minority, right, but like the
financial minority.
Right, the minority that is using it for bad and not using it for them to be able to create a life. So now I just looked up these two facts that will come together in this explanation. African Americans make up more than 40% of the homeless population, about 13% of the general population. This is from National Alliance to End Homelessness .org, I believe. And then this is from the whitehouse.gov. Let's see.
And let's keep in mind that the whitehouse.gov is going to be a little bit biased. Because, I mean, it is currently under Trump.
But I definitely...
whitehouse.gov isn't necessarily written by his administration. Well, it is.
Well, I mean, it is.
Yeah, but there's other people.
Just keep in mind that it is from the White House itself, so... I mean, just as the last source was...
Okay, so, and like I said, the 40% of the homeless population are African American, I believe.
Okay.
African Americans make up more than 40%. And then in here it says, the surge of minority... getting jobs has helped push the U.S. workforce across historic threshold. For the first time, most new hires of prime working age, 25 to 54, are people of color. So if you look at this, I'm mostly assuming a lot of these homeless people are getting jobs. I mean, I can only assume that, right? Because
yeah,
if you look at the surge in minority jobs and the sheer number of homeless people that are minorities, they have to be going to some of them.
Well, a lot of like homeless people and stuff, like just speaking of like off of like what I've seen through my own eyes, is that a lot of them have like really like entry level jobs like McDonald's, Dunkin' Donuts, stuff like that.
That's where it starts, though, right?
That's where it starts, and then they work their way up from there if they do so, and if the pricing in that city is manageable to live off of.
So going off of what you said, getting like a minimum wage job, we do also need to recognize that's not always a living wage.
Yeah,
some people are living on the streets with a job. Like that's something that we also need to address.
Exactly. But those jobs, essentially, I feel like that's not the target audience that those jobs are necessarily for. It's more for like kids, either younger people or people in retirement. So like the people in between that's kind of like where those like homeless people have kind of gotten screwed because they never had.
That's a scary place to be in.
It's like in the middle of like being middle aged and not having an entry level, like you didn't start at the same time most Americans did.
And okay, so on the other thing, backing off of what you said with how that, so I'm assuming you support increase in minimum wage.
Yeah.
Okay, so backing off of that, if you look at the sheer number of jobs, a lot of places you go anywhere, you'll see a help wanted sign. It is everywhere. There's so many jobs for so many people, and all these companies naturally wanting for people to work at their business are already increasing their minimum wage. So I don't think we need a national minimum wage to go up, because a lot of these companies are already raising their minimum wage because they need people to come in and work for them.
Do we know that they're going to raise their minimum wage? Like, can we like get like a fact on that?
What do you mean?
Like,
Do we know that companies are raising their minimum wage as we speak?
they're doing that. For example, like Amazon and Target. Like the minimum wage in the state of Wisconsin is $7.25. Target has raised their minimum wage to at least $10 an hour, and Amazon raised theirs to $15 an hour.
Yeah. So
if you're a Wisconsinite working at the very base level job at the Amazon facility in Kenosha, you're making at the very least $15 an hour. Whereas if you're a base level employee at the Target, any Target in this state or any state that has the basic federal minimum wage level in this country, you're going to be making at least $10 an hour. So they're doing that as like an incentive to kind of like get people to work for their business. They're fighting for like people to work for them.
Well, and then just as another factor to consider is what is the quality of work like?
The quality.
Because I mean, as we've seen the almost like slave-like conditions that that these Amazon workers have to be put through. These very poor working conditions. It's like, here, we'll pay you a lot, but you're gonna have to like suffer for it. It's like just something to consider. It's like if someone needs the money, they're gonna get that job, and then are these companies taking advantage of these people? Because I mean, like we've seen things come out as to what these workers have to do. I believe someone can feel free to fact check this, but I believe it was there was not like a shock collar, but a little buzz. If in Amazon you're going the wrong way, they give you a little buzz and you have to go the right way, or you have to turn or
like
move.
while they're delivering these items.
So like, I mean, like they are putting the, so what I'm trying to say is quality of work is something that has to be considered.
I could see like physical stuff that's not necessarily okay in my opinion. Literally putting a shock collar on someone, that's
I mean, like,
now, is it
I don't
a
think
buzz, or are they actually like doing like a little like muscle contraction or something?
Electrical.
I think it was a little muscle contraction. Yeah, because I mean, like that was like the whole thing coming out of it.
So like essentially, Amazon employees wearing like an anklet or like a prison bracelet, like a probationary bracelet, while they're out delivering. What you're saying?
Yeah, we can. Oh, that's.
Yeah, I'm looking up. Yeah. Okay. Muscle contraction device.
Just
Amazon
like
workers.
Amazon working conditions, basically, is what we can.
So like, I mean,
I'm not sure if it was called a muscle contraction device.
So like, I mean, if you were working for like a certain company and you have a bracelet that tracks where you are.
No, yeah,
I mean, that's totally fine. But if it's gonna like
give you a little notification,
physically punish you for it, that's not. Because like they're human, they're not a dog who's running outside their boundary.
No, yeah, like I mean, like, but like the fact that like then it's like, we know you need money, we'll give you a little bit more money. Now come and work for us and suffer. Then that becomes an unhealthy relationship, and then now we have a whole new issue.
Well, then
so
it's for many Americans in this country, working isn't necessarily a pleasant experience. Like, not everyone wants to work every day.
I know, but you should at least be treated like a human being.
Yeah, true.
Are you gonna say? Well, not always, Christopher. You see, sometimes you need to get on your.
Well, I mean, you can't if you're like a base level, like you can't expect like the highest respect of. No. Like if you're a new like me, for example, like when I started my job at the Golden Match, I was just like looked as a newbie. Like I didn't know anything about the job. And I was like kind of looked down on. But then as I worked hard and I proved myself that I could follow those, they looked at me as a higher position. They ended up paying me more, and I ended up being like given greater responsibilities and a little more trust. Well, also, so like if these employees, like for example, for Amazon, giving them these conditions like the muscle contraction device on their thing, is that because like they're treating their employees terribly on purpose, or is it like a lack of trust in the employees that the company has? So like. What's a good example I could think of? Like if there's certain employees who are doing things that they weren't supposed to do in the past, and that's like more of a preventative measure as opposed to like just something they're doing just to like make it an unpleasant experience for the worker. That's kind of what I'm thinking.
Yeah.
Like I'm saying that like I absolutely believe that the muscle contraction, the electric shock devices, that's not okay. But like I'm just saying like it's a is it like I'm trying to decide whether it's just like a purposeful abuse that Amazon is doing, or whether it's like a trust measure from like a lack of trust that they have developed like from other past employees.
I'm not sure if it's based off of past employees. I just think maybe they don't have enough trust in their employees in the first place. Because I'm just trying to look it up right now. These working conditions, people saying people are peeing in trash cans, shamed because they came to work hurt, possibly not encouraged to take time off. Which, I mean, that's just an issue in and of itself in the U.S. But yeah, things are clearly not going well. But it's bringing it back to the larger picture. I think we need to work with the people of this country to make sure that they have a living wage, that they're working at a place that isn't treating them like a pet. And we need to work with people who are not at that point to at least getting a living job to get to that point. And we need to work with them, not see it as an issue to deal with.
Okay, and now this whole conversation started with
Who's gonna win
2020 election.
Yeah.
Right. Okay.
Yeah.
So we come, but it's good because now, how do you think, if hypothetically, if Trump were to get elected in 2020, how do you think he can do? What do you think he can do to fix that?
Well, I think he would maybe have to adopt some leftist views that maybe he's not willing to. I think he needs to work with people across the aisle who may be able to help with these things, such as Bernie. I mean, even if Bernie loses, I mean, he's still in the Senate, right?
Yeah, he's a Vermont senator.
Yeah. So I think he will need to make compromises that he's not always willing to make, and that may mean like a large shift in who's going to support him, and that might mean disappointing some people who supported him for being so far right. But sadly, I mean, like, that would mean like a total change of who Trump is as a person, and I don't know if you see him doing that. I don't see him doing that. I mean, that would mean like a whole different person.
I don't necessarily see him implementing universal healthcare, but I could see him doing some sort of healthcare like overhaul type thing.
He's not doing anything for it right now, as far as I'm aware. So I mean,
they're writing. They're trying to figure out
they're writing like a counter to Obamacare.
To fix. And I think a lot of there are some things that he is using Obamacare to kind of like form this new idea of healthcare. So he's using some ideas from Obamacare that aren't as left, more conservative views that are in that Obamacare. So,
and like using another personal anecdote of like what I've just seen in comparison. So like I said previously, like I have cousins who live out in the UK where they have a universal healthcare type thing. They have a private sector and a public sector that kind of work simultaneously of each other. When they came here, one of their kids was scraped and ended up like taking an infection that kind of incubated.
Here in America?
Yeah, here in America. That they couldn't get out using just over-the-counter pills or other like home practices. We had to take him to the ER, in which they were able to get treated like right away, and he was able to get out of the hospital like the next day in less than like 24 hours. And they got that treatment. Their travel insurance was able to cover like almost like 80 or 90% of the costs. And then in comparison,
that's travel insurance though, not if you.
No, like just that's their normal insurance that was covered. That covers internationally because they're from
the UK. So this is a UK insurance policy.
UK insurance policy.
Okay.
And they were just amazed at how fast American healthcare like was able to cover them and get them out of the hospital, because they said if a similar infection or type thing happened over in the UK, in the public sector, they wouldn't be treated for like another week.
And well, I know from experience, my brother got sick in England, and we were all ready to pay like a bunch of money because we're overseas, and they're like, oh no, it's free, and we're like, for real? And I mean, so I think it's like cost versus time. Hopefully there can be a balance in there, but But
again, like who's paying for it? Since you're not paying for it, who is going to pay for that?
Yeah, like what I was saying about like our current system is that under federal law, a hospital can't refuse service no matter whether you can pay for the cost or not, because that's why like when you're filling out paperwork in the hospital, you have to put down your bank information, so like they can tell what your entire like net worth or where you can get like money from. If I go like, let's say when I turn 18 and the current money that I have in my bank account, which is extremely little in comparison to the average American, and I wasn't able to cover, like, let's say I had some sort of like leg injury or something, and I wasn't able to cover the cost of the surgery to get, I would still be able to obtain the surgery, pay a lower price or no price at all, and then that debt that I'm not able to pay would be distributed among other future customers of that hospital. Okay. So, for example, like let's say it costed like $1,000 for me to get that done. I can't afford that. for other procedures, whether it's like just giving someone pills or whether it's like a brain surgery or something, it's going to be, the debt is going to be distributed and added extra cost to those other procedures that people can afford.
Okay. Well, and then so just as a story that, I mean, like, this really happened, but I was a fan of this guy's music. He was a singer, but he was crippled. He had been wanting to kill himself. I mean, he had tried a few times, but later in his life he had some health issues, and he had health issues for a while, and he had been in debt for so long, and he was so close to death that these health issues and the cost, he saw no way out. And keeping in mind that he did have mental health issues, he killed himself because he couldn't afford treatment. And also that also shows a failing just of our health system to not help him with those mental health issues in the first place.
Well, like I remember,
So I mean, like, no one should even have to get to that point.
Yeah,
no one should have that trigger.
Exactly.
That, like, I can't afford this. I only see one way out. They like
Okay.
But so, like, going off of, like, just from what I've heard in the past, like, for example, in English class, how White House was telling us about like the mental health facilities that colleges currently have, like, for free for students. If, like, certain employers and stuff had that, like, mental health to kind of, like, help out employees who are going through a mental crisis from work stress or other things like that, do you think that that would be a good solution as opposed to, like, the current issue where we don't have any?
they need to be funded.
Yeah.
They need to be funded for sure. And I think, I mean, like, that's like,
Who are they going to be funded by? The people who are actually utilizing these tools, or just everybody? It's going to be, like, distributed. Do you know what I'm saying?
Yeah, not government distribution. It would be paid for by the company, but, like,
well, I mean that's if we're looking at, like, private.
yeah, true.
Yeah. I mean, like, to me, I'm just thinking, like, what keeps coming up in my head is that, like, the massive amount of money that we spent on our army, and we pour all of our money into that when, frankly, we could be pouring more money into getting a universal healthcare system going, or getting more money into those social programs such that they aren't having to struggle and ask for donations left and right. I think if we look at it, yes, the U.S. has the biggest military in the world, but we shouldn't necessarily be proud that we're leaving these people in the dust in favor of our army. I think, like, we need to look at where we're putting our money and maybe put it where the issues are. And I know many people I talk to say that we should focus on the U.S. before we help other countries. I'm like, great. Then we're going to have to make some cuts, and we're going to have to change things. We can't just, like, say that and not do anything about it. We need to actually put our money where our mouth is. So, yeah, I think we should help the people in the U.S.
So, like, one thing I see with the army, like, we do put a lot of money into, like, the U.S. military. It's, like, tax money, but, like, people in the military have, like, VA benefits. So, like, they have, like, all, like, close to free healthcare, but it's not the best of quality.
Right, so
like,
it's not going, like, straight to, like,
Yes.
guns and weapons, right?
Yes, it's not going straight to go. It's paying the salaries of the people in the military.
Yeah, and the support of them when they're coming out of the military.
Well, and also I would say that support is not always there. I mean, we see these homeless people on the street who served in our army, and now they're homeless. But just saying, can we, like, I would like to know the distribution of our government spending for the military, or else talking about this, like, makes no sense.
All right, you can fact check that, Joey. But, like, going off of, like, what you said about, like, homeless veterans on the street and stuff, I don't necessarily want to say. How can I say this?
I'm not saying every veteran's homeless. I know.
I'm just saying
it's an issue.
I know. I'm just saying that there's a certain. I think in, like, today's climate, how, like, certain cities are expressed, like, for example, like San Francisco, Portland, and stuff like that, and, like, tent cities and stuff, that there's kind of become a mistrust of, like, the people advertising on the streets, like, for like drug abuse or whatever, and then, like, for veterans, are saying, like, for someone holding a cardboard sign on the street saying, veteran,
homeless veteran,
yeah. And, like, they're wearing, like, an Air Force hat or something like that.
Yeah.
Is that there's no way to, like, necessarily verify that they were a veteran, thus verifying that they can or can't get help. Like, I can literally go to, like, any store, like, online, buy U.S. military, like, merch and whatever. So, like, my thing is, like, what if there's a way for, like, to verify if, like, a homeless person was in the military, like, if they were given. Like, let's say, like, they were given a number that, like, people could look up. So, like, they could write that on their sign, like, homeless veteran number, whatever, and I could look it up. And if it comes up as them, then I know they're not lying, and I can, like, physically help. Then I can, like, help them with that.
Well, going off of the data, veterans make up 11% of the homeless people. Now that seems like a small number. It's still, I mean, 11%.
So that
That's
just means
1 in 10.
Yeah.
I mean, so I mean, I think it is an issue. Just going off the system that you brought up, are we going to then assume that people coming out of the army are going to be homeless? It's like, here's your number if you ever, become homeless. We hope you don't.
No, like not just for homeless, like just to verify that they were in the army for whatever. Like if they go get a job or whatever, like they
That
want
surely
benefits.
exists
What?
A
Like,
verification system.
for if you were in the army.
Yeah.
Yeah.
Yeah, but he's saying, like, if you just see him on the side of the street, how are you supposed to know that
Okay,
he,
well then-
he was a veteran? Like, I'm not
Yeah.
going to go up to him and be like, give me identification on how you were a veteran. Like,
yeah.
that's ridiculous.
Yeah.
You just can't, Okay, so to the breakdown of U.S. budget breakdown.
And this is like within the military budget.
No, this is
okay.
this is just in general, but it's interesting to know.
Okay.
So, all right, let's see. The government expects to spend 4.7476 trillion, almost 60% of the total budget pays for mandated. Okay, so sorry, 4.746 trillion is total American budget. This is our budget in total. Now, 60% of that pays for mandated benefits such as Social Security, Medicare, and Medicaid. So, as you can see, obviously more than half is actually going for these things that you're talking about of medical like help. So compared to military spending, which has included in the budget, the biggest expense was of the Department of Defense base budget at $576 billion. So let's see.
Colin,
Yes.
You were sorry. I'm just gonna bring this up.
Yeah.
You were in AP Gov. Did you see that graph where it's like such a big of a portion was taken up by the
Yeah.
Where did that come from?
The money's coming from?
No. Where did that graph come from? Because I know I saw somewhere that's like the gap between military spending and like healthcare spending.
So okay, so
But no, I
anyways,
mean, going off of what you said, then it should be getting put to good use.
right.
I don't see it.
This graph?
I don't see it getting put to good use. I
This
mean, I
graph?
think, yeah.
From PolitiFact?
Okay, so anyways, Department of Defense base budget $576 billion. Operations were estimated to cost approximately $174 billion. That pays for the war on terror costs triggered by the 9/11 attacks. These included ongoing costs from the war in Iraq and Afghan war. Military spending included $212.9 billion for defense-related departments. These included Homeland Security, the State Department, and Veteran Affairs. These departments also received emergency funding of $26.1 billion. Added up, and the total is $989 billion for military spending. And comparing that to the Medicare spending, which is 60% of $4.746 trillion. Obviously, a major difference. Over $2 trillion is spent for this Medicare and all this kind of stuff, and only just under $1 trillion is being spent for military spending. So obviously there is money going towards Medicare and healthcare benefits and all that kind of stuff, but we just need to know where it's going.